My aunties, my brother-in-laws, my sister also passed away because of liver cancer. My beloved teacher, he died when he was 43 years old. And we found out that he has been infected with the hepatitis B, and he passed away.
These stories can be heard throughout WHO's Western Pacific region. This is because the region has the highest rates of hepatitis B infection in the world. In 2005, countries of the region joined together to do something about this public health problem. They agreed to set a milestone to reduce infections in children to less than 2% by 2012, and a goal to reduce infection rates to less than 1%. Thanks to a safe, effective, and affordable hepatitis B vaccine, this goal is achievable. Many countries began using this vaccine in the early to mid-1990s, and vaccination coverage has increased steadily. And because of effective national vaccination programs, the region as a whole, and at least 30 of the countries and areas, are likely to have reached the 2012 milestone.
The story of hepatitis B control in Western Pacific region represents a huge success. An important part of reaching the goal is to have a process to verify if countries have reached the goal. And now 9 countries have been officially verified and several are in pipeline.
It is now time to go beyond our less than 2% milestone and prepare to reach our less than 1% goal.
As was the case with smallpox way back, as we saw in polio, as we've seen in polio, there's always these hard-to-reach populations. And I think EPI has consistently shown that it can really get to these population groups. It's done so in the past very successfully, and it's been doing this even in hepatitis in this region also at present.
It also means protecting newborns because they may be at risk of getting infected from their mother during birth. They can be protected if their first dose of vaccine is given soon after birth, preferably within 24 hours after birth. Timely newborn vaccination can be challenging, especially in rural communities. In Laos, a mother describes how some of her babies were delivered at home, and a week had passed before she could bring them to the health center. Difficulty reaching newborns is not limited to rural communities. Urban areas have their challenges too. For example, a study done in the Philippines showed that many women in highly urbanized settings with geographic access to health facilities chose to deliver at home without a skilled birth attendant, most likely because of financial barriers or tradition. An ideal solution is for all women to give birth in health facilities. In recent years, the region has seen very successful models of supporting women to give birth in health facilities, especially in China and Cambodia. Even with the challenges, significant progress has been made, and we should celebrate these gains and continue to progress towards the region's goal.
Before vaccinations, more than 7% of children in our region had chronic hepatitis B infection. By reaching our milestone, infection rates are now less than 2%. And now we must keep this momentum and strive for our goal to reduce infection rates in children to less than 1%. We can do it, and we must do it, and now and for the future.